It is the joy and expectation of every expectant mother walking into a hospital for delivery to leave cradling their newborn baby. But for some, that joy is shattered by a rude shock when their babies die prematurely. For these families, the healing journey is long and painful. At the Machakos Level 5 Hospital, a revolutionary bereavement support program has been launched to help grieving parents cope with such loss. On TV's Electino Dera reports on how this program is changing maternal care and giving hope to families facing the unimaginable.
Samuel and his wife walked into Machakos Level 5 Hospital in January with hope in their hearts, expecting their first children, twin boys. They had already imagined their future as parents and even chosen names. But their joy was cut short. The babies, born too soon, succumbed immediately after birth due to complications.
Tarehe 5 mwezi wa kwanza nikajifungua twins na kipati baya wakafariki, so naweza tu sema hivyo.
The pain is still etched in Susan's heart. The loss was devastating.
It was our first time my wife apate mimba na ilikuwa mara yake ya kwanza. So we expected tutakuwa na twins na tutaringa na wao tukifurahia because they are our first kids.
For the couple, the bereavement process offered by the hospital became a lifeline, helping them cope with grief that had seemed unbearable. They remain grateful to the nurse who worked with them during their darkest hours.
They gave us words, powerful encouragement, to an extent that one of the doctors, Dr. Kate, gave us some bracelets with the name of our twin boys. That was Max and Vitalis. Then she gave us hope that maybe one day, a day that we don't know, a day that God knows, He will bless us with more and more kids.
Nurses at Machakos Level 5 Hospital have since launched a new program to support mothers and families who lose their children through preterm birth. The initiative, inspired by training from the Zuri Nzilani Foundation, is transforming how bereavement care is delivered.
We also encourage that do not be in a hurry to remove the baby from the mother's side. If the mother has the strength to stay with the baby, we dress the babies for them in their chosen clothes, especially in labor ward, so that the mothers get to have the last picture of their babies as a well-dressed and smart baby, not a flaccid baby.
Catherine Mweni, a nurse at the facility, explains that in the past, families who lost babies were often told to move on quickly with little acknowledgement of their grief.
We also allow them to have time with the family, with the baby. We are doing so many things that get to give these mothers respectable maternal care, and we allow them to grieve. We are not in a hurry to take those babies to mortuary.
Ashley Muteti from the Zuri Nzilani Foundation says the organization is leading a movement in maternal and newborn health with a focus on hypersensitive disorders in pregnancy, such as preeclampsia, and improving quality of care.
A program that is equipping healthcare providers with mental health, communication skills, and also system-level things that they can start in their facility to be able to help parents who are grieving. Because we believe that even at death, parents still deserve dignified care and quality care.
As part of its care, the hospital now provides counseling sessions, debriefs families on possible causes of preterm loss, helps parents cope with postpartum depression, and supports them in planning for future pregnancies. In Susan and Sammy's case, the nurse even wrote a card using the names chosen for their twin boys, honoring their memory.
Ni sawa. Kuna siku tunaweza sahau, lakini tunakumbuka tu, lakini tunaelewa. Ipo siku tutajaliwa tena.
There before we used to brush off, it's just a baby, you had not bonded with the baby, so it's okay. But no, we are here to say that it's not okay because they loved this baby. Whenever a mother conceives, they start bonding with their children straight from the womb. By the time they come to deliver this baby, we even realize that they have names for these babies.
Globally, preterm birth is a leading cause of child mortality, with WHO estimating that about 13.4 million babies were born preterm in 2020. Of these, nearly 1 million die each year, while millions more survive but face lifelong health challenges. In Kenya, prematurity remains one of the top causes of under 5 death. Though many preterm babies do survive with proper neonatal care. Alexina Odera, NTV, Machakos County.